Welcome to our presentation regarding your 2017 Employee Benefit Program through Total Highway Maintenance. The benefit guide that you're given has some very important information on it, and please note on the back cover that your guide has important phone numbers and websites for you for year-round reference. Every new employee must either enroll in Benefits in Hand, which is our online enrollment tool. This is our preferred method because you can review all of your personal information, give us your beneficiary information in one quick application. If you cannot enroll online, then we ask you to call the number listed, 866-419-3518, between 8 and 5 Central Standard Time. And then lastly, if you can't do either of the above, there is an enrollment form that you can complete and turn in. But you must make your election for medical, dental, and vision, and enroll directly with our AFLAC representative for those supplemental benefits that we'll be discussing later in the presentation. Once you make your elections, you cannot make changes to your elections until open enrollment next year, or unless you experience a qualifying life event. Every employee must enroll either online, through the call center, or via enrollment form before your effective date. If you're going to waive all your coverages, we still need you to log in and decline coverage for each line of coverage. If you have any questions or if you need any special assistance with your enrollment, again, please contact Higginbotham Helpline between 8 and 5 Central Standard Time, and the service number is 866-419-3518. If you have questions, you can call, or you can actually email helpline@higginbotham.net. In order to enroll, we are using an online enrollment system called Benefits in Hand. You simply go to benefitsinhand.com, and first-time users will follow steps 2 through 5, and returning users will simply log in and start at step 6. But if it is your very first time to log in, you'll click on New User Registration, and once you register, you will use your username and password to log in. You'll enter your personal information and a company identifier. Your company identifier is in all caps. It's THMLLC, and then you'll click Next. You'll create a username. We recommend a work email address, and you'll create a password. And then you need to click on I agree to the terms and conditions before you click Finish. If you've used an email address as your username, you'll receive validation email to that address that you may now log into the system. Click the Start button to begin your enrollment process, and confirm or update all of your personal information, and click Save and Continue. If you need to edit dependents or add dependents that are going to be covered in your plan, you'll need to do that now, and once all your dependents are listed, you click Save and Continue. And then you simply follow the steps on the screen for each benefit to make your selection. Please note that there is an option to decline coverage. If you want to decline coverage, simply click on the I don't want this benefit button and select the reason you're declining. Once you've elected or declined all the benefits, you'll see a summary of your selections. Click the Agree button. So please remember that your enrollment is not complete until you click that Agree button. If you have any issues while you're going through the system, or if you don't have a computer and you want someone else to make your elections for you, simply call our Employee Response Center at 866-419-3518. They're available to help you navigate this Monday through Friday, 8 to 5. The elections that you make right now will go into effect on the first of the month following 60 days of full-time employment. The elections that you make will remain into effect until January 31st, 2018, and again, you will not be able to make any changes to your elections unless you experience a qualified life event. The qualifying life events are listed here for you, but marriage, divorce, legal separation, birth, adoption, placement for adoption of an eligible child, death of a spouse, any one of these is considered a qualifying life event. But you must notify HR within 30 days of the event if you want to make changes to your benefits. If you wait beyond the 30 days, then you can't make changes until open enrollment next year. You have 2 medical plans that you can choose from. The first is the base plan, and the second is the buy-up plan. In our presentation, we will be covering in-network benefits only. If you choose to go out of network on the buy-up plan, or if you're in Louisiana on the base plan, you may do that. If you're outside of Louisiana on the base plan, you do not have any out-of-network benefits. The name of your network is the Choice Network on the base plan and the Choice Plus Network on the buy-up plan, or if you're in Louisiana, also on the base plan. Your most often used benefits are highlighted here for you. When you see your primary care doctor, it's only $35 on the base plan and only $30 on the buy-up plan. United Healthcare has virtual visits. You can log on to myuhc.com, navigate over to the virtual visits, and actually speak with the doctor via chat 24 hours a day, 7 days a week, 365 days a year for just $25. And if treatment is necessary, they can call in prescriptions for you to the pharmacy located nearest to you, and you don't even have to leave work or your home. If you need to see a specialist, you have two options. United Healthcare has designated specialists, and that means that they have better outcomes with their patients. If you see a designated specialist on the base plan, you'll only pay $35, and on the buy-up plan only $30. But if you choose a specialist in their network that's a non-designated specialist, you'll pay $65 on the base plan and $60 on the buy-up plan. All of your preventive care is covered in full, 100%. If you have other services and you need to have lab or x-ray, a CAT scan, an MRI, hospital admission, or outpatient surgery, you first have to meet a deductible. The deductible is $5,000 for an individual on the base plan and $2,000 on the buy-up plan. If you're covering family members, your whole family would never pay more than $10,000 in deductible on the base plan or $4,000 on the buy-up plan. Once you meet your deductible, then the plan covers everything at 80% and you pay an additional 20% until you meet your out-of-pocket maximum. If you need to go to the emergency room, you have to pay a $250 copayment plus 20% of the charges. The physicians within the emergency room will go toward your annual deductible, and you still have to pay 20% of the charges after you meet your deductible. There are more affordable options for you if it's not a true emergency. You can go to a credentialed urgent care clinic and only pay $75. You can find your urgent care clinics available to you on myuhc.com, or you can call United Healthcare and they'll help you locate a credentialed urgent care center with them. Be careful, because some freestanding emergency rooms say they also take urgent care, but they're still billing as emergency room. I don't want you to get caught in that trap. So make sure you contact United Healthcare if it's not a true emergency and find out how that billing will happen. The most that you'll have to pay in a calendar year is considered your out-of-pocket maximum. For an individual, that's $6,350 on the base plan and $12,700 for a full family. And on the buy-up plan, it's only $6,000 or $12,000. Again, non-emergent out-of-network benefits are not available on the base plan unless you're in Louisiana. And if you choose to go out of network on the buy-up plan, you can do that. Please see the full benefit summary and know that those will be more expensive and will cost you more out of your pocket. Your pharmacy plan is the same on either plan that you choose. United Healthcare stratifies their medications by Tier 1, Tier 2, and Tier 3. If you're on a Tier 1 drug, which is mostly generics, you'll pay $20 for a 30-day supply. Tier 2 drugs are $40 for a 30-day supply, and Tier 3 is $75 for up to a 30-day supply. You can get your prescriptions by mail order if you're taking maintenance medication, and a maintenance medication is just something you take every single day. You can get that medication for 2.5 times your copay and get a full 90-day supply, so it does save you a little bit of money. Generics actually have the same active ingredients as the brand name medication and cost you less out of pocket. Many pharmacies have generic drugs for as little as $4 or $5, so make sure you check that out as well. There could also be other options for your prescription needs through services such as GoodRx.com. So if you have time to shop for your medication, go to GoodRx.com and see if those might be an option for you. This slide shows your 2017 Medical Weekly Employee Contributions. You can see the base plan, how much it will cost you each week, as well as a buy-up plan, depending on who you're covering under your plan. People often ask me which plan is the best for me, and that's really a personal decision, but I would look at how much it's going to cost you to have the plan, look at the services that your family uses most often, and then determine which plan is actually going to cost you less when you consider your co-payments, your co-insurance, your deductible, and weigh that against how much it would cost you out of your paycheck each and every week. I talked briefly about virtual visits with United Healthcare, but virtual visits is a great way to get urgent care that's not a true emergency, after hours, or if you can't get in to see your doctor. First of all, you'll need to register on myuhc.com if you haven't already. Step 2 is you just request a consult. After that, you'll be talking with a physician about your health concerns, symptoms, and treatment options. And then step 4, they're going to help resolve that issue, and then you'll give them payment. And the payment again is only $25, and you don't even have to leave your home or work. Virtual visits can be used any time of the day or night, 24/7, 365 days a year. They're there when your physician's not available. You don't have to have appointments. They have after hours. You can also contact them while you're traveling, and you don't want to have to go find a nearby clinic. If you're considering visiting a hospital emergency room for a non-emergent health condition, you might want to reconsider that, because remember, the emergency room is your most expensive place of care. You can call, talk to a physician, and get your non-emergency conditions treated through virtual visits. Their top things that they see you for are things like bladder infections, urinary tract infections, bronchitis, cold, flu, diarrhea, fever, migraine headaches, pink eye, rash, sinus problems, sore throat, stomach ache. All of those can be treated virtually. If you need a prescription, they're going to use best practices in prescription management, meaning if they can prescribe you a generic, they'll do that. That helps save you money. They cannot give you controlled substances, meaning they can't give you hydrocodone, OxyContin, or any of those high-powered pain medications, but they can give you medications that are not controlled substances. They will not give you psychiatric medications or lifestyle drugs via virtual visit. They do have a 98% generic prescribing rate, and maybe your generic would be one of those $4 or $5 generics at your local pharmacy. They do e-prescribing, so they will send your prescription to the nearest pharmacy for you. United Healthcare also has lots of tools and services to help you be a wise consumer. If you have a x-ray coming up or an MRI or other outpatient testing, you can use the My Healthcare Cost Estimator under myuhc.com to get an idea of how much that will cost you at different providers, so that you can go to the highest quality, lowest cost provider. Again, you need to register at myuhc.com if you've not already. You'll search your condition or treatment, you'll get a quick estimate, and then you can select the provider or facility of your choice, and that will provide you with a final estimate of cost. United Healthcare is actually mobile. Health for Me is a mobile app that United Healthcare has developed. You can get information to help you stay connected to your care management team. You can view and share your health plan ID card via email or fax. You can check your account balances and benefit amounts, so you'll know where you are in your deductible, where you are in your co-insurance. You can view and manage your claims. You can even use all of the great cost estimator tools that are so valuable when you're seeking care for those high expensive MRIs and CAT scans. And you can connect with your healthcare professionals 24 hours a day, 7 days a week for those virtual visits. United Healthcare has some customer service agents that are designed to be your advocate. They're there to help you determine, first of all, if the treatment you're being prescribed is covered under your plan, how much you'll have to pay out of pocket, meaning what goes to your deductible or copay or coinsurance. They can also help you decipher what charges on your bills from providers are and if it's truly what you owe. So if you get bills from a provider and you don't understand it, please be sure to call and speak to one of your advocates. They can help explain what your benefits are, and they can help you even find new doctors within the network. You can email Advocate for Me at uhc.com, or you can call the customer service number listed on your health plan ID card to be connected with an advocate. Your dental plan is also with United Healthcare. You have an individual deductible of $50, but no more than a family deductible of $150. So if you're covering 5 or 6 people on your dental plan and you all have services, the most your full family would have to pay in annual deductible would be $150. On dental, there's an annual maximum benefit, and that means it's the most that United Healthcare will pay in benefit in a calendar year per covered person under your plan. So that's $1,000 per person covered under your plan. Your preventive services are covered in full, and you do not have to meet your deductible. But for your basic and major services, those will be covered at a coinsurance after you meet your deductible. Your basic services are covered at 80% and you pay 20%, and major services are covered at 50% and you pay 50%. Orthodontics is covered for children only, and it's 50% after your deductible. There is a lifetime maximum on orthodontics, and that's $1,000. So once United Healthcare has paid $1,000 in orthodontics, then there would be no additional benefit paid. You don't have any waiting periods for your services unless you're a late entrant, meaning you don't join the plan when you're first eligible. If you choose to go out of network on this plan, you can do so, but you will be reimbursed based on the maximum allowable charge, which means based on if you were in network. So if your doctor bills more than a network dentist charges, your plan will reimburse based on what your network dentist charges, and then you will have to pay your share of the network benefit as well as the difference in what your dentist charges and the network dentist would charge. Your vision plan is also with United Healthcare. If you go to a network provider, you will get your best benefit available to you. You may go out of network and you do get reimbursements, but the reimbursements are not that great. So if I were you, I would not enroll in the plan unless I was determined to go in network. When you see a network provider, you can have an exam every 12 months for $10. And then you can get materials every 12 months for a $25 copayment. You can get single vision lenses, bifocal lenses, trifocal lenses, or lenticular lenses, and those are covered in full after your $25 copayment. Your retail frame allowance is every 24 months, and you're allowed up to $150, and then you get a 30% discount on the amount over that. So if you pick a $200 frame, you get $150 for free, and then you get 30% off of that remaining $50. You can get contacts in lieu of lenses and frames, and you can get contacts every 12 months. The covered selection of contacts, you can get up to 6 boxes. There is a separate contact lens fitting fee and evaluation fee of $10. And if you get non-selection contacts, you get a $150 allowance. The contact lens evaluation and fitting is included in your allowance. If you need medically necessary contacts, those are covered in full, but I will tell you that less than 1% of the population has medically necessary contacts. So the majority of you would fall under the 6 boxes or the $150 allowance. The weekly employee contributions for your dental plan and vision plan are listed here, and those again are weekly contributions, and they will be taken out pre-tax. You can cover yourself only on your medical plan, and then cover you and your spouse on the dental plan and just you on the vision plan, or vice versa. So I guess what I'm trying to say is you can mix and match any way you need to. They're not all tied together. So if you just cover yourself on medical, you're welcome to cover others on your dental and vision plan. THM has a very nice 401k through T. Rowe Price that's available for you to enroll in the first day of the quarter following 60 days of your employment. THM matches 50% up to your first 6% that you contribute. So if you contribute 6%, they will match that with 3%. The maximum contribution you can make for 2017 is $18,000, and if you're over 50 years of age, you can actually contribute $23,000. You are not eligible to take loans against this 401k, but there are hardship withdrawals if the hardship is a documented and qualified event. There are some options for you to have a pre-tax regular 401k or actually after-tax Roth options if that would be a better investment for you. And you have 13 different investment options to choose from. If you have any questions about your 401k, please call T. Rowe Price directly, and their phone number is 1-800-492-7670. Their website is rps.troweprice.com, and they also have an app for your iPhone. So what do you have to do? You need to complete your enrollment form. You need to either elect or waive coverage for your medical, dental, and vision plan on your paper enrollment form. If you want the AFLAC products, you'll need to enroll directly with AFLAC for those supplemental products. And again, remember, whatever you enroll in now, you will be enrolled in through January 31st next year, and you can't make any changes unless you have a qualifying life event. As we wrap up this presentation, I just wanted to remind everyone to review your benefit guide and make sure you enroll prior to your effective date. The earlier you enroll will mean that you'll get your ID card sooner. We don't want anyone to wait till their effective date to enroll and then not have any information and ID cards. As a reminder, every employee must log into Benefits at Hand, or call the Higginbotham Response Center, or complete the enrollment form prior to your effective date. Our preference is for you to log into Benefits in Hand. Second, call the Response Center, and then the last resort would be to complete an enrollment form. If you don't wish to enroll in any benefits, you still need to log into Benefits in Hand, call the Response Center, or complete the enrollment form to waive all coverages. If you have any questions or need assistance with your enrollment, please contact the Higginbotham Employee Helpline. Spanish assistance is available Monday through Friday, 8 to 5. Our service email is helpline@higginbotham.net. Our service number is 866-419-3518. And your dedicated account manager at Higginbotham is Misty Hackrott, and her number is 817-347-6823. Thank you for your attention, and welcome aboard.